Hello, everybody. This is Dr. Jack Fu. This is Gary. So today we will doing the special. It's we have the acupuncture book. This is the Chinese. This is the English. And right now we will try first time try. Use Gary speaks the English. Then I will explaining that. So the 11 the chapter, let me see. 11 the chapter should be 12. Okay. So I will read the Chinese first, then Gary will read the English, then I will use English explaining. Let us try it like this, maybe can more explaining. The 第11章病因病机，病因就是引起疾病发生的原因，病机就是疾病的发生、发展与变化的机理。中医学认为，人体各脏腑组织之间，以及人体与外界环境之间，都是在不断产生矛盾和解决矛盾的过程中，维持着相对的动态平衡，从而保持人体的正常生理活动。如果某种影响超越人体的适应能力，人体一时不能通过自行调整和适应，这时人体的内部以及人体与外界环境之间失去相对的平衡，于是发生疾病。疾病之所以是否发生，固然与各个致病因素存在有关，更重要的是取决于人体的生理功能对于外界环境的适应能力，这是中医学对发病机理的基本关联。本章会就病因病机的内容分别加以论述。
The subject of etiology is the study of causative factors of disease, whilst the study of pathogenesis concerns the actual bodily processes whereby disease occurs, develops, and changes. Traditional Chinese medicine holds that there is normally a state of relative equilibrium between the human body and the external environment on the one hand, and among the zongfu organs within the body on the other hand. This equilibrium is not static, but is in a state of constant self-adjustment, and in this way, the normal physiological activities of the body are maintained. If external influences exceed the powers of adaptability of the organism, or if the body itself is unable to adjust to changing conditions, then this relative equilibrium will be lost, and disease will develop. Whether a disease occurs or not, whilst associated with the presence of various causative factors, is primarily determined by the physiological adaptability of the body to the natural environment. This is the basic viewpoint of traditional Chinese medicine regarding pathogenesis.
That's good. So I want to explain to you, most important is a balance. The balance for the Chinese medicine is the most important. So basically, say body have immune system, the body made some problem, maybe sleep too late or you're too stressful, the body get changed, but the body still have the function can balance you back. But if sometime you cannot balance back, then we can use the exercise, we can use the acupuncture, we can use Chinese herb, balance you back. So basically, this is Chinese medicine, the most important, just one word, balance. Next one is the first chapter, 第一节病因。人体致病的因素很多，总的可以分为六淫、七情、饮食、劳役、外伤、虫兽所伤，以及痰饮、淤血等。任何疾病的症候都是在某种原因的影响下，患病机体所产生的一种病态反应。认识病因，除了作为致病因素的客观条件外，主要是着眼于病症的临床表现，也就是通过对疾病的症状和体征的分析来推求病因。这种方法叫做辨证求因。学习致病因素的性质和特点，主要是掌握它们所致病症的临床表现的特征。 第一就是六淫，六淫就是风寒暑湿燥火，是自然界6种不同的气候变化，在正常的情况下并不能致病，称为六气。只有在气候异常急剧的变化下，人体抵抗力下降，六气才会成为6致病的因素，侵犯人体发生疾病。这6种致病的因素就被称为六淫。由于六淫是不正之气，所以又被称为六邪。六淫为病，其发病途径多从肌表、口鼻而入，都有从外感受的特点，因此把六淫引起的疾病多称之为外感病。六淫为病多与季节气候、居住环境，如夏天多暑病，冬天多寒病，久居湿处多湿病，故有湿病之称。六淫既可以单独使人致病，又可以两种以上同时侵犯身体致病，如风寒感冒、风寒湿痹等。六淫在发病过程中不仅可以互相影响，而且可以在一定条件下互相转化，如寒邪入里可以化热，暑温的日久可以化燥伤阴等。OK， 病因 Chapter 1。
Etiology. Numerous factors can cause disease, and these include the 6 exogenous factors, the 7 emotions, improper diet,
听一下
overstrain, lack of physical exercise, traumatic injuries, bites by insects or wild animals, as well as stagnant blood and phlegm fluid. The symptoms and signs of any disease reflect the pathological reactions of the affected body to certain causative factors. The causative factors, therefore, are studied both as the objective causes of disease and in the specific ways they affect the body. On the basis of this understanding, traditional Chinese medicine is able to identify the causative factors of disease by analyzing the clinical manifestations. This is known as seeking the causative factors by differentiating symptoms and signs. The study of etiology, therefore, is based on developing a profound understanding of the characteristic clinical manifestations produced by each causative factor.
Basically, this part talk about what's the reason cause you out of balance. Like we said, balance is the most important. What's the reason cause you out of balance? So if you want treat the patients, you first need to find the reason cause this. That's why we see the Chinese medicine always find your problem, the root. That is we go back to find the why you have this problem. So basically problem, they can cause get sick. It's kind of like the 六淫、七情、饮食、劳役、外伤、虫兽所伤，以及痰饮、淤血等。Can you read this one more time? The first part.
The 6 exogenous factors, the 7 emotions, improper diet, overstrain, lack of physical exercise, traumatic injuries, bites by insects or wild animals, as well as stagnant blood and phlegm fluid.
I hope you understand these words. The Zeus, can you understand these words? The 6
exogenous factors.
Yeah, exogenous factors. That's important. Okay, then next one. Yeah.
Specifically, the next section is about the 6 exogenous factors.
I already read.
Wind, cold, summer heat, damp, dryness, and fire, or warmth and heat in parentheses, are the 6 climatic changes found in nature. Under normal conditions, they do not produce pathological changes in the body and are thus known as the 6 types of qi in the natural environment. These 6 types of qi will only cause disease if either the climatic changes are extreme or sudden, or if the body's resistance is low. When responsible for inducing disease, the 6 types of qi are known as the 6 exogenous pathogenic factors. All the 6 exogenous pathogenic factors, when affecting the body, invade from the exterior via the skin, mouth, or nose. For this reason, the pathological reactions they induce are known as the exogenous diseases. Diseases due to the 6 exogenous factors are closely related to seasonal changes in the weather and to living environment. For example, heat syndromes mostly occur in summer, cold syndromes in winter, and damp syndromes are usually caused by prolonged exposure to damp. Another term for these syndromes is seasonal diseases. Each of the 6 exogenous pathogenic factors may affect the body singly or in combination. Examples are common cold due to pathogenic wind and cold, or bisyndrome due to pathogenic wind, cold, and damp, etc. In the process of causing disease, the 6 exogenous factors may influence each other and may also, under certain conditions, transform into each other. For example, pathogenic cold may transform into heat in the interior of the body, and prolonged summer heat may result in dryness by consuming the yin of the body, etc. The properties of the 6 exogenous factors and their specific pathological influences on the body are described as follows.
Yeah, the 6, that's called what? The 6
exogenous factors.
Exogenic.
Genius
The
factors.
6 exogenic factors. Exogenic factors. 6 exogenic factors. The wind, cold, hot, dampness, dry, and warm or fire. That is the most reason cause your problem. If overdo it, your body is balance the first one, right? The first reason, why you out of balance, because you maybe have the wind throw in your body. Then the beginning from the skin go inside, beginning made you feeling cold. That's why most of the time if you have cold, you first feel the cold. You feel you running the nose with very clear, you feeling the cough, the mucus, it's very clear, and you feel cold, chilly first. But the cold can change to the heat. A little while, like we see, when the cold go inside, they can change to the heat. That's why a little while, because you're cold in your body, then they wake up your body before the some out of balance. Example, this part of time you have constipation, you are eat some too spicy food already, then you get this cold, then they go inside, made your body out of balance, they will change to the heat, showing to your sore throat, showing to running you cough out with the yellow and the dry cough, all the running the nose like the yellow and the mucus like that is sticky. So that means already showing the heat. That's not the cold. So beginning it's a cold, but slowly, quickly, maybe 1 or 2 days, they already change to the heat. So this part they clear tell you it's the 6
exogenous factors.
Exogenous factors. It's they can each other change. They can from the skin go inside. They can match with a different time. They can the one single like the wind can make you have problem, or the hot can make you have problem, or they can mix together like the cold with the dampness. They together made you have problem. So that's hope you understand. Okay, next one. 解释六淫的性质和治病的特点，分别描述一下。一、风为春天的主气，但一年四季均可发生。汗出当风或迎风而卧，都是感受风邪的重要原因。妹妹，你要仔细听一听啊！汗出当风或迎风而卧，都是感受风邪的重要原因。一、风为百病之常。风为六淫主要致病因素，凡寒暑燥热等邪，多依附于风邪侵犯于人体，故《素问·风论》说：“风者，百病之常也。”风邪不仅能与六淫相兼杂，有时还能与病理性产物之痰相结合，成为风痰而致病。如面瘫，多半是风痰阻络引起的病症。 二，风为阳邪，其性开泄。风为阳邪，具有生发向上向外的特点，故风邪伤人，容易侵犯人体上部、头面肌肤，并使皮肤腠理开泄，常见头痛、鼻塞、喉咙火痛、面部浮肿、恶风出汗等症。三，风性善行而速变，风邪具有来去迅速、变化多端之特点，故治病后具有行无定处、变幻无常、发病迅速特点，如痹症中关节疼痛、游走不定，便属风邪偏盛的行痹，亦称风痹。风疹也为风邪之病，又有皮肤瘙痒、时隐时现、此起彼伏的临床特点。三，风性善动，即指风邪具有动摇不定的特性，故治病后可出现眩晕、震颤、四肢抽泣、脚弓反张，如破伤风患者之脚风反张，面瘫患者口眼歪斜、面肌痉挛，这都与风邪这一特性有关。The first, wind.
Wind is the predominant qi of spring, but may also occur in any of the 4 seasons. Wind may easily invade the body after sweating or while sleeping. Wind is the primary exogenous pathogenic factor in causing disease, since cold, damp, dryness, and heat all depend on wind to invade the body. It is stated in the 42nd chapter of Plain Questions, wind is the leading causative factor of many diseases. Pathogenic wind can not only combine with the other 5 exogenous factors, but also with phlegm to form wind phlegm. Facial paralysis, for example, is mostly seen as a consequence of the obstruction of wind phlegm in the meridians. Wind is a young pathogenic factor and is characterized by upward and outward dispersion. It can therefore easily invade the upper part of the body, in other words, the head and the face, and the exterior portion of the body, leading to impairment of the opening and closing of the pores. Clinical manifestations are headache, nasal obstruction, itching or pain in the throat, facial puffiness, aversion to wind, and sweating. Wind in nature blows in gusts and is characterized by rapid changes. Disorders caused by pathogenic wind, therefore, are marked by migratory symptoms, rapid changes, and abrupt onset of disease. The migratory joint pain of wandering bee syndrome, which is caused by pathogenic wind and is known as wind bee syndrome. Urticaria is caused by pathogenic wind and is characterized by itching of the skin and wheals which appear and disappear from place to place. Wind is characterized by constant movement. Moving pathogenic wind in the body can cause dizziness, vertigo, fremitus, convulsions, and opisthotonos. Examples are tetanus and deviation of the mouth and eyes with spasm of the facial muscles.
So this just try explain to you the风, the wind. 风在我们治疗中医当中是非常困难的，是很多问题都和风有关系，遇风就比较难治。风呢，它讲的一些特色，风为百病之长啊，风为阳邪啊，风善行而速变啊，风性善动啊，等等，这些都是风的特色。We talk about the wind. Wind is the most difficult to take care of it for the Chinese medicine. Because they very easy connect with any other, the reason can cause you this problem. You know, example, they can mix with dapless, or they can mix with like the cold, wind with the cold, wind with the dapless, wind with the heat, all can mix together. So it's even made the mucus, that is more difficult. So that's the wind, it's hard to take care of it. And the wind, it's going up, going for the outside. That can easy to the headache or the running nose or sore throat, something. And also wind, very easy change. And wind they throw your whole body. They can come in your nose, they can make you the runny nose. Come in your head, can make you headache. Come in your body, you cannot control the shaking. That is all it's a match with your wind. So wind is very important one. For the first one, the 风寒暑湿燥火，有的说是风寒暑湿燥热也可以。Okay, next one 是寒为冬季主气，其他季节也可以见到，但不如冬令之盛。冬寒季节衣着单薄，会淋雨涉水，汗出贪凉等，都容易导致寒邪。寒为阴邪，易伤阳气。寒为阴邪，侵犯人体阳刚之气受损，人体失去正常的温煦作用，临床表现为明显的寒象，如形寒肢冷、脘腹冷痛、下肢清骨、下利清骨、小便清长。寒性收引凝滞，收引即收缩牵引，凝滞即凝固凝闭不通。由于寒邪有此特性，所以容易导致人体腠理封闭、闭塞，经脉挛缩，气血运行不畅，而出现恶寒、无汗、肢体屈伸不利、寒性痛症等临床的表现。总的来讲，就是寒，简单讲是冷，是一种阴邪，容易伤阳气。寒有收引凝滞，就是不通的，就像我们通则不痛，痛则不通，它就寒气容易阻止你打通。你看很多地方汗出，感冒也是汗出而解，你的疼痛也是汗出而解，就很多地方没有汗，就是很大的问题，所以会谈到有出汗的问题。So the cold, it's in the winter, but the cold is called the yin, the problem. They very easy damage your yang. We like our body, the yang always keep good. If you have the cold, they can showing your body wants the heat. Also the cold, they can showing they sticky there, they block you. So that's why if you here have pain, we regularly see here have the cold in here. They block you. The qi be blocked. So how we can throw the qi out? Regularly it's han ze wen zi. We use the heat, made the cold go away. Then you're feeling low pain, or they can help you immediately. That's why keep the body warm. That's always the best. The next one, you already read or not? Code.
Not yet, I can, yeah.
You did the code?
No, not yet.
Okay, please code. I go forward.
Cold, the predominant qi of winter, may occur in other seasons, but not as severely. Thin clothing, exposure to cold after sweating, being caught in rain, and wading in water in cold winter can give rise to invasion of pathogenic cold. Cold is a yin pathogenic factor which consumes the yang qi of the body. As a result, the warming function of the body will be impaired, resulting in symptoms such as cold limbs, cold pain in the epigastric and abdominal regions, diarrhea containing undigested food, and increased flow of clean urine, etc. Cold is characterized by contraction and stagnation, resulting in impairment of the opening and closing of the pores, spasmodic contraction of tendons and meridians, and impaired circulation of qi and blood. Accompanying symptoms include pain, aversion to cold, lack of sweating, and restricted movement of the limbs.
Very good. I think this, if I use English explaining some, and I read the Chinese, he read the English, maybe better for your understanding. How about you feel, the Ruth and Jeff? Do you feel like this? You can understand more?
Yeah, it's great to hear the English version. Yeah.
Yes. Okay, right now, we don't have too much time. I will review about today, we talk about it. Today, I think the most important, we talk about the one word, balance. The reason cause your problem, right? Mm-hmm. Basically principle is a balance. Then what's the most reason cause your problem? It's a six
Exogenous factors.
yeah, 6 exogenous factor, and also your emotional, 7 different emotional, and also it's your diet, and also how about your sleep or rest, and also it's a damage from the
Injuries.
injuries, and also maybe be bite or from some
Insects or wild animals. Yeah.
insect
Mhm.
animals, and 痰饮
Stagnant blood and phlegm fluid.
one more time.
Stagnant blood and phlegm fluid.
Phlegm fluid, phlegm fluid, and first words
That's the phlegm
after
fluid is the
bite.
last. Bites by insects or wild animals, as well as stagnant blood and phlegm fluid.
Dyson blood and phlegm fluid.
Phlegm
That
fluid,
yeah, that is means you sticky. Your body inside some blood be sticky, or because the inflammation made you sticky there. That is basically reason cause you out of balance. So then we beginning talk about the really 6
Exogenous factors.
exogenous factors. Exogenous factors, that is the wind, cold,
Summer heat.
summer heat, dampness, and dry,
Yeah.
and the fire.
Yeah.
That's the most important 6 words. Then we talk about these 6 words. They can mix together. They can match with the different time. They can from the skin to outside inside. That's basically the 6 exogenous phenomena. And the first one is a wind. Wind is most of the reason cause your problem. And the wind, it's yang the problem. That's why most it's a skin or the top head. And the wind, it's a change very quickly and also easy to move. So made you the shaking or something. And also second one is a cold. Cold, it's easy to damage your yang. They showing you very cold. And also the cold, they block you, the blood flowing, everything. A lot of time, if you have the sweat, then they can change the cold. So basically, this is the way today talk about it. Okay, so that's it. Okay, we try this. Maybe it looks good.